Hi everyone, I'm Dr. Rashmi Sharma and welcome to your YouTube channel Origyn IVF. Today we are going to talk about a very common condition called as endometrial polyp. What is an endometrial polyp? Endometrial polyp is a small growth or small tissue inside the internal lining of the uterus. We know uterus has got two layers. One is the muscle layer outside and another is the internal endometrial layer. Endometrial layer acts like a soil for the baby. Okay. So there are some structures like small polyps on the body that you see, just like that inside the uterus as well. How it is detected? If there will be many patients in which there are no symptoms at all and it is diagnosed only on the ultrasound. And there will be some patients who will have complaints of irregular uterine bleeding or intermenstrual bleeding where they're having continuous spotting in between the menstrual cycles. And then sometimes these patients can also have heavy menstrual bleeding. And infertility is also a very common symptom of polyp. So if there is something sitting inside the uterus, it acts like a foreign body and doesn't let the embryo implant or the baby implant. So if you are suffering from infertility, ultrasound is a very important diagnostic tool to diagnose endometrial polyp, and you have to get it corrected if you are trying to conceive. How it is diagnosed? The diagnosis is very easy. It is based on the ultrasound. The ultrasound is very sensitive test to detect the endometrial polyp. But it is very important to see that when the ultrasound is done. If the ultrasound is done after the ovulation has happened, it will fail to detect the polyp, because once the egg is ruptured, endometrium changes its character. It becomes homogeneously white, and so that's why separately we are not able to see those small growths. So the best time to detect polyp in ultrasound is immediately after the periods, before the ovulation. That is the initial phase of the menstrual cycle. So it also becomes a source of confusion for so many patients, because in one of the ultrasound it shows that there is a polyp, and then when they get it repeated next time without bothering about that what day we are getting the ultrasound done, that ultrasound doesn't show polyp, it just shows a thick lining. So it is not that the ultrasound is wrong. No, maybe we got the ultrasound done at a wrong day. So this is a very important thing. And in some cases where we have a confusion, even during the ultrasound, like we are not sure whether it's very small or it is just like an endometrial infolding, in that case we like to put in saline inside the uterus, which is known as sonohysterography. It is also a very simple procedure during the OPD only. With a small plastic catheter, we put in a lot of saline inside the uterus so that the uterus gets inflated. Water looks black on the ultrasound. So there is water inside the uterine cavity which is black, and inside we can see the polyp. Right? The polyp size may vary from few millimeters to centimeters. The bigger the polyp, bigger the problems are. Now coming to the treatment. If you are suffering from infertility and you have been diagnosed with a polyp, it is very important that it is removed, and removal is through surgery only. Surgery is hysteroscopic polypectomy, which is a very simple, very easy surgery. For the patient, there is no cut on the abdomen or anywhere. For you, it is like an ultrasound. You get admitted, you are giving anesthesia, so there is no pain. Anesthesia for 15 minutes, half an hour, depending upon how much time it takes. And then we put in a small telescope inside the uterine cavity and then see the uterus from inside, and we can see the polyps hanging, and then cut it from the stalk and take out the polyp and send it for testing. So it is very easy surgery. Don't be scared of it if your doctor has suggested it to you. I hope this video helps you in some way and decreases your anxiety about the diagnosis of polyp if you have been diagnosed with a polyp. If you wish to come to our center, the number is seen on the screen below. You can give a phone call and come to us. Or if you wish to consult online, there is an online link in the description box, and you can take an online consultation. Thank you so much.